there's been so much abuse in medicine to women. I've said it before, and I'm not going to dive too deep into it today because it's a fact. Let's all just accept this as truth. The women have not been well managed, well cared about, well thought of, just well treated. Okay. And you know it as a woman, and you've given trust to this institution only to have that trust broken frequently. And you still go back to it. And then sooner or later, though, you're going to point where you're like, I'm sick of this. And you're like, I don't want anything to do with it. And we're seeing this now. I see this now. And I see it out there in the medical landscape that I'm in my area of Arizona. I see it online. It's obvious. There's a huge tilt away from the standard medical model. It's out there. It's just moving. It's obvious that it's moving in that direction. The thing is like when someone has betrayed you that much, it's easy to just say everything that they said and did was wrong and bad. And it's easy to say whatever's the opposite of what they did is going to be better. And that's how the mind works a lot of times. We tend to go into this binary approach. What I want you to know is there are people on the other end of the binary equation that are going to tell you things like, yeah, everything they say is wrong and you don't need, lab work. You see, my agenda is starting to slip in, isn't it? I'm not subtle. There's nothing hidden with me, but it's true. You'll have people out there who are going to pander to your anger, who are going to stoke the worst part, and they're going to pull you in this direction. You don't need this, whatever they said and did, because the betrayal of your trust is truly wrong. But that doesn't mean all the things they were talking about were wrong. It's just the way it was used was wrong. And you were not given correct care. That doesn't mean science is bad. That doesn't mean the medications are all bad. Some are bad, true. But I'm trying to make a nuanced point, and it matters to me because I care. I want to do a good job. We always run the risk that when we've been betrayed so much that we throw out the good with the bad. My podcast is an attempt to salvage that, to not let the baby get thrown out with the water, so to speak.